a PATH counseling session. It is 5 sessions over the course of up to about 6 to 7 months. What's really interesting is that once someone is in our study, we meet with them once, we meet them again a week later, and then we start to spread it out. 1 month later, 2 months later, 3 months later, to really allow time for the conversations to sink in. And with each session, we talk about goals that focus on health, sometimes disclosure. Another one is around reducing sexual risk and just kind of quality of life stuff as well. So we allow time so that way someone can actually go out there and really practice those skills that we're talking about, that we're building in each session.
What happens is they meet with a non-judgmental, supportive professional who can normalize the fact that people are still getting HIV and can minimize the feeling that I'm disappointed myself, I should have known better. And the counselors, if you meet our counselors, you get, listen, let's not even worry about this. This is where it is, let's move on. So the very fact that that first session is a safe space to kind of discuss your feelings and not be judged, I think that entree, that's your first entree into accessing care. And I think if that's a positive one, which PATH offers, I think that's the most important thing there.
And our entire spin is very optimistic. It's not so much what you've done in the past that may have been good or bad, but really looking forward and thinking about what are some positive, healthy changes we can make to really improve your quality of life, and to know that, you know, they can still have goals and dreams.
Navigating care can be difficult, and I think that one of the biggest benefits of PATH for participants is helping link participants to care.
Just making sure that people know where they're supposed to go and then they're accessing healthcare the way that they need to.
There are so many counseling interventions or options available, but very few of them are specifically tailored to men who have sex with men or same-gender loving men. And the intervention is provided at 2 of the biggest HIV care organizations in the city, and so it's really easy for you to get connected to care and get the services that you need.
This short-term counseling that focuses so much on having a positive life, a healthy life moving forward, that focuses on them accomplishing goals so that way they can have a sense of confidence and self-esteem.
Entering into a program where you're meeting accessible people who are non-judgmental, who are offering support, and who are saying, okay, now let's take care of you. Let's see what you need to stay healthy. They give information that normalizes it. They cut down on the fear of dying, the anxiety of the medications.
And they're going to be able to be looked at as a whole person versus just a number, just a participant.
What are your goals for you? What are your goals for sexual risk behavior? What are your goals for how do I access health? Where do I want to be in 3 months, in 5 months, in 5 years, concerning my body and my health? So I think that's really the important concept of PATH, really.
To all newly diagnosed men who may identify as gay, bi, questioning, you know, on a DL, same-gender loving, whatever, you know, you identify with.
Do not let HIV define you.
Don't look at this as necessarily an ending or something that's bad.
It is not your definition of you. You're still you, and you're still a member of a community. You're still a gay man or trans or whatever.
Really take your health into your own hands and go out and find the providers that will provide you with the best care for you.
You know, there's still services that are out there. There's doctors that can help you. You can still live your life and be okay.
If you get connected to care and you start treatment and you get virally suppressed early, you can live a long and healthy life just the same as someone who doesn't have HIV.
You can have a healthy and fulfilling and responsible sex life and love life after the diagnosis.
Someone said the other day, I have to give up my dreams, and we said, why? You can pursue all your dreams, but you have to take care of yourself and your body. And I think that's the message I give you.